Let's speak a little bit to what I think most families really want to know, and that is like, what side effects have you experienced? How are those treated? And then if you haven't said like what the result has been so far and you're comfortable saying it, would you guys go ahead and speak to that too?
So the result from my first one was very subtle. We could see slight shrinkage in my tumor altogether, mostly around its borders. And I would say they never put a number on it, but to me it looked somewhere around 10 to 15%. So it was encouraging because that was the first time my tumor had ever shrank. But it was not quite the result I wanted to see. The second time, however, was so much more encouraging. When we finally got the MRI after the inflammation left, so I have two parts to my tumor, which basically there's a top part and a bottom part. I can't explain it any better than that. But to the bottom part, that shrunk over 50%. And then the top part shrunk 25% with a bunch of shrinkage of my overall pons. My ventricles became much more clear. And overall, I went from not barely being able to walk, barely being able to swallow, to having almost full mobility again. I couldn't quite jog or run, but I was able to use both hands. I was able to tie my shoes to everything that you normally would. And so it was life-changing for me as at that point in my life. I was very worried. I was overcome with anxiety about the future, but that was just so encouraging. So recently, in the month of April, I believe, I went back for dose number 3. Again, it was pushed into my MI catheter. However, I had a very different experience, and we didn't know why until weeks later. But again, it was unexpected but encouraging. So what ended up happening is I experienced immediately a headache, kind of some aches and pains through my body. I had kind of a weird fever, but it was very low. It was nothing like I'd experienced before. And that lasted for about a week. And so I thought, I mean, at that point, I just figured it didn't work. Maybe it had messed up. And at that point, I found myself kind of questioning why I even do this trial if it's not going to work. It's terrible. I have to be with my friends, yada, yada, yada. And then all of a sudden, again, I was hit with what I like to call the storm of symptoms, to where I had a very heavy fever. I was rushed to the ICU again. And I went through all of these symptoms that I had experienced before. Unfortunately for me, it caused this new headache, and we couldn't quite figure out what it was. Basically, it was a headache that any type of regular pain medication would not touch. So the team began with what you would do with any type of pain by putting me on this ton of pain medication. For me, it was fentanyl, and they put me on a high dosage, and that had ramifications. But luckily, I figured out a couple of days later that the pain wasn't necessarily fixable with pain medication. It was actually more resembled a migraine based off of some nerve that I have in my brain that was being infected by inflammation. Affected, not infected, my bad. But so they put me on what they called a migraine cocktail. Basically gave me a bunch of different types of migraine medication, and it relieved my headache within 15 minutes. And so from there, I built back mobility. I was in the hospital for that time, I believe, about 26 days, which had a toll on me just because I was in bed a lot. I ended up losing a bunch of weight, but as soon as I got out of the hospital, I immediately started feeling like myself again. Was able to go back to physical therapy and really start working back towards um, this new normal.
I would say too that from the second dose to the third dose, there was no regrowth. And the last MRI still showed no regrowth for days. So that was kind of an added blessing that that 50% reduction stayed. And then he had further reduction from that this time, both in the bulkiest part and then in the hole. You will see that Jace has a side of his mouth that droops. He has a cyst that lies along that particular nerve. And while at Stanford, they did the first Omaya catheter to the cyst in his pons. And so about every 2 weeks now, he goes to have his pons drained. There's no pressure in that cyst they've found, but it does fill up with a byproduct of the tumor. And after providing an Omaya to Jace's cyst, I think, did Derek get one added to his as well? So
Yes.
they just
And,
keep,
yes, and a VP shunt, actually. He actually has 2 Omayas and a VP shunt for draining purposes. And they've been very helpful to us.
so even if somebody's not looking for CAR T out there, but you know that they have a cyst that's causing them problems, Jace would get lockjaw, have the droop. That's an option now that's being performed at least in a few places. So who else wants to talk about different?
Kyra too. I saw, thank you, Jace, for sharing your experience. I saw some similarities and actually some differences also, because Kyra has currently going through her 3rd dose, right? And we found that her first dose with the chemotherapy was actually very tough. She was vomiting every 30 minutes. The whiteboard was filled up where we were, writing down her records. And the CRS was pretty bad. But for her second and this one, the 3rd dose that went through Omaya, actually her reaction was quite mild. And even the medical team also found that her reaction is fairly mild. And for the 3rd one, she's still currently going through it right now. Can't speak too much of it. Still constantly monitoring. But so some similarities and some differences. So I guess it kind of speaks to that. Everybody is a little bit different, but so kind of keep that in mind, I think.
Yeah, absolutely.
And how has Kyra's shrunk?
So I think for dose 1, we saw a lot of clinical improvements, similar to what others have said, finger movements that weren't there before. We saw, I know what Dr. Monge likes to call it the Mickey Mouse inside the brain. There's an area that kind of controls limb movement. So we saw a lot of shrinkage there. We never heard any quantified numbers, but we saw visually, before, after, there were shrinkage. I think for the 2nd and the 3rd one, I can't speak to right now because it's still going. There could even be inflammation in her brain right now for the 3rd. For the 2nd one, we saw some different clinical improvements, maybe, voice, the loudness of her voice, even, little minute things that you may want to record videos here and there sometimes, so you can remind yourself, what was she capable of doing and what can she do now. The MRI saw some other areas improve, but again, we never were given like quantifiable numbers, but at least visually that we could see. And I think right now for her most current one, there are some maybe inflammations, so it's hard to say whether there's improvement yet or not. So
I'll share from our experience. We were told we were given 6.5 weeks to do radiation and that we had time to settle on what clinical trial, depending on what the biopsy revealed and what he's eligible for. At first we wanted to pursue ONC 201. And then we got news that Levi did not get picked up for ONC 201, and it crushed our heart. It crushed our heart so much. And so we said, you know what, on to the next thing, let's do CAR T cell. So he finished radiation in September, and he also had a rough recovery with radiation. So the problem that we found ourselves in is that no clinical trial will pick you up if you're not stable. That word stable became our miracle to ask for. Like, God, please just let my kid be stable so that we can get to this next phase. He ended up getting an emergency shunt put in to take away the drainage because he had hydrocephalus. The radiation caused the tumor to get so angry that there was so much swelling going on. He couldn't walk. He couldn't eat. He was vomiting everything up. And it was the scariest time of our lives. So after the shunt and also being on steroids, that also created a big issue because he could not go to a clinical trial being on steroids. So I'm trying to wrap it up briefly. September radiation ended with his diagnosis in July. Late September emergency shunt. Through October, we had to wait for the healing from that surgery so that he could pursue Avastin. And then he was getting weekly infusions of Avastin. The important part with the Avastin was to get him off the steroids. Again, that became our key: get him off the steroids, get him stable. In December, I had a telehealth consult with Dr. Vatanza that our oncologist in Colorado helped us get. Spoke with Dr. Vatanza, and I don't care about specifics with CAR T cell. All I cared about, is this going to help? Is this going to make my baby feel better? So when he asked me if I had any questions, I said, yes, when can we get him? So late December, early January, we got word that Levi would get picked up. Now, with clinical trials, it can be really frightening in this waiting game of when we can go. There's other kids involved as well. So we just had to wait for our time. Mid-March, so Levi went up to January and February to get an apheresis so they can collect the blood. So mid-March is when we got the phone call. Your cells are ready. His cells were ready on by the 8th of March, which was my husband's birthday. So he was like, happy birthday to me. The cells are ready. So by March 16th, we were able to come up and start our treatment.
So, oh, go ahead, Emily.
So first of all, I want to say that when I was offered the CAR T trial, I had the choice between that or ONC201, and that was a kind of difficult decision, but I decided with CAR T. And so I was treated from September to February. I am not on it anymore, but the symptoms were pretty minimal. Headaches if I moved a lot, like any more than from the bathroom to the bed. So I stayed in the hospital for a couple of days after. And then the thought of food was revolting. So I ate a lot of pudding and smoothies and stuff.
So to answer your question, Vanessa, it was Emily started the CAR T cell therapy 19 months after diagnosis. When she started it, she was stable and walking and doing most things normally. She did the regular 60 to 30 days, 6 weeks of radiation, and then for an entire year, every other week, she would get Avastin, temozolomide, and irinotecan. And
Okay, so these are the drugs you're all talking about that I
yes,
guess.
drugs.
Do they work or they not work?
It worked the radiation and that combination of drugs worked really well for her. She took it for an entire year. And we saw over 50% shrinkage in the size of her tumor. And then she went the whole summer with just pretty much, I think it was Avastin every other week, just Avastin. And then she kind of had to back off the Avastin to get her Ommaya surgery because of the bleeding risks. So she would have Avastin here and there, just a few times here and there. And then she started the CAR T cell trial September. Yeah, and she did okay. And then she was stable. Her tumor is still stable. It's the same. There hasn't been any
And it's much smaller than before. Is that what you're saying?
Well, it was not from the CAR T trial.
It was smaller from radiation, but then I had to stop pretty much all treatment to get the Omaya and the apheresis and that stuff. So it pretty much grew back to size.
Okay.
No,
A
it's the
little
same.
smaller.
It's the same size. It's the same. Yeah. So now, so she left the trial in March. Was it March? February, end of February, because even though the tumor hadn't gotten bigger, it hadn't gotten smaller, and she started seeing more symptoms, like not being able to talk and the usual DIPG things. So because she was the first one, we were very tied to the rules. Like with Levi, it sounds like he's getting it every week. She was only, and I think Maria too, every other week at a certain dose. And because of the rules, the third patient had to have been on treatment for 3 months.
Three
Right?
patients.
Three
Patients for 3 months without like reactions to the dosage.
Yeah, so we were not able to get any changes further from there because of those rules set forward. But Levi's experience is very different than Emily's, probably with dosing too. We could maybe swing back around it. Right now, she did another round of radiation, and then she's on panabinostat right now, and Avastin every other week, and we've seen another 15% decrease in the tumor.
Oh, that's wonderful.
Yeah.
That is wonderful.
Oh, Emily.
5%, I'm sorry.
Keep correcting, Emily. You made it to the 5% club past 2 years.
Yeah.
Keep going, girl.
Yeah, because I don't see change unless it's 5% or more.
Well, Emily, you definitely inspired us.
Same here.
Yes,
Definitely.
absolutely.
My experience was a lot like Emily's. First off, I was diagnosed only a few months after her, but found her story during radiation. So I've kind of gotten the privilege of following in her footsteps in a way, of kind of just seeing everything from a few months behind of where I'm going to be. But like Emily, I didn't have the opportunity to do CAR T cell right after my first round of radiation and chemotherapy. I did radiation for 30 days and chemotherapy. I had 30 rounds of radiation. I think it was a total of 6 weeks, but I had chemotherapy the whole time. And that's kind of where I started to see symptoms. I think I just remember a 4th of July experience where I overheated, I started throwing up. It was a terrible experience. It was kind of the first time that I really knew like how devastating this diagnosis could be. But then I got an ONC201. This is about 3 months after diagnosis. I started ONC201, and it was very successful in keeping my tumor the exact same for about 11 months. So this brought me around to a month 13 or 14, and that's where I had the decision of either starting this new trial of CAR T cell therapy or continuing the trial of ONC201, which may or may not be still working in my brain. And that's how I came to the CAR T cell treatment.